All right, so again, for ICOHS College Employee Benefits effective March 1st, 2023, here is our contact information at our office. You're welcome to reach out to us anytime throughout the year if we can help you in any way. A quick agenda of what we're going to go through. We'll talk about our timeline of open enrollment. We'll talk about our medical plans. We'll talk about how we enroll, which will be a new way this year than we have in the past. And then if you have any questions, you need any answers, you're welcome to interrupt me in the middle of this presentation. I will also stick around for as long as any of you are on the call if anybody wants to ask questions at the end of the presentation. So again, please do so. And if you have questions after the presentation, again, here's our contact information. So what is open enrollment? This is the time of year where you can enroll in benefits, you can waive benefits, you can add a kid, you can remove a spouse, you can change plans, you can do whatever it is you want to do with your medical plan. Today's February 15th. Open enrollment goes for 7 days, ending February 22nd. If there's anybody that needs a little bit more time than that, or you've got some special needs or questions, please reach out to us so we can help you efficiently make a good decision for your family. Any changes that you make will go into effect on March 1st. So if you were to log in right now and change your plan, it doesn't change instantly, it changes March 1st. Again, we're asking everybody to do this no later than it's Wednesday, February 22nd, not Thursday, sorry about that. And then you'll complete your applications online at the EASE Benefit Enrollment Portal. So we'll get into that a little bit as well. So we've got KAISER, and we got 3 medical plans available, the bronze, the silver, and the gold. So these are the 3 plans that are available to us. Here's a big spreadsheet that kind of goes over the 3 of them side by side. You'll notice our bronze plans, these are going to be the lowest cost plans available to you. When you get into the enrollment portal, they'll be very attractive in terms of how much they cost. But beware, the bronze plan has a very high deductible of $6,300. All right, we'll talk about some of these definitions here real quick in a second, but I want to just touch on each of these 3 plans. So your bronze plan is going to be your real low cost option, very inexpensive, great for those of you who don't really ever use your health insurance plan. You just want something in case you have a major event, but you don't have any plans on using your insurance. Our silver plan is kind of that middle ground, good value plan, still very competitive, low price on your per paycheck cost. And then the gold plan is going to have the best benefits, which is good, but it's going to cost you the most. Okay. So speaking of these benefits, let's use this silver plan right here in the middle. And as I talk about these different terms, just consider how they apply on these other plans as well, which will kind of bounce through each of them. So a deductible is a term that refers to the amount of money that the insurance company basically says you must pay all of this number first before we pay any portion of the cost. So with our bronze plan, that's $6,300, silver, it's $1,900, gold, it's $250. All right. Now, I'm going to skip down a little bit, and you'll notice the term DED waived. DED waived means the deductible is waived. To say it another way, in other words, if you need one of these benefits, like an office visit, on the silver plan, you do not need to meet your $1,900 deductible first. You are able to get you are able to go see the doctor for a copay. A copay is a term that refers to a flat dollar amount, a total number that it would cost to see a doctor or to get physical therapy or get a prescription drug. Any of these numbers that are a whole number, not a percentage or anything like that, these are called copays, meaning if you want to see a doctor on the silver plan, it'll cost you $65 to see a regular doctor or $100 to see a specialist, deductible waived. So if you enroll in this plan for the first time on March 1st and you get sick on March 2nd, you can go see a doctor for $65. That's all it's going to cost. Now, if they send you downstairs to get x-rays or lab work or you need prescription drugs, those are extra costs. But these copays here you see are the total amount that it costs to go sit in that office with that doctor and be consulted on what's happening. Okay. Notice how our bronze plan has copays of $65 and $95, deductible waived, that's good, for the first 3 visits only. Okay, what this means is if you have this bronze plan, you can go to the doctor 3 times for $65, a regular doctor visit, a regular doctor primary care visit, or $95 for a specialist, or all the way down here, this urgent care, $65, okay? Combined office limit means all 3 of these options, your primary care doctor, your specialist, and the urgent care, you have combined 3 visits. So that means if you go to a regular doctor for $65, that's 1. A specialist for $95, that's number 2. And an urgent care visit, that's number 3. After you use those 3 visits, you will then pay 100% of the cost for doctor visits, urgent care, up to $6,300. All right. This is why this bronze plan is a little risky for any of you that might be needing to use your health plan. After 3 doctor visits, you're on the hook to pay 100% of the cost. That's what this 3 visit means. Now, with our silver plan and with our gold plan, the deductible is waived, and there is no such limitations on how many times you can go to the doctor for that copay. All right. So when they waive the deductible, that means you do not need to pay this deductible that you see at the top. You are not on the hook for 100%. As we go down a little bit further, we see things like diagnostic lab and x-ray. So diagnostic lab, this is usually blood work. If they draw blood and they're doing some diagnostic tests, or x-ray, of course, we know what an x-ray is. This is going to be on the silver plan. It is a copay, but notice it says after deductible. Same thing with MRI. So imaging is a CAT scan, a PET scan, an MRI. After deductible, $400 copay after deductible. So when you see this after deductible, it means that if I need to get my blood drawn or an x-ray or a CAT scan, MRI, PET scan, I'm going to have to pay 100% of the cost up to $1,900, and then I pay a copay of $30 or $75 or $400 depending on the service. Another thing I'd like to say about deductibles is it is a cumulative year-long number, all right? So it is, if you went and got an x-ray and it cost you $150, say, you're gonna pay 100% of that. But now you've met 150 of your $1,900 deductible. So now you only had 1,750 left to go. Okay, so every dollar you're spending outside of these deductible waived copays, everything, all these other things you're spending is going towards that deductible. And once you meet that deductible, you've met it for the calendar year, and then you get these copays. Okay. Down here, we have a copay for $65 deductible waived. And this is for physical therapy, occupational therapy, speech therapy. So that's what rehabilitation and habilitation is. You have a copay deductible waived. So if you have a kid that's going through speech therapy, or if you get knee surgery and you need rehab, you need weekly visits to get your knee back into shape, that's $65, no limit on that. Chiropractic care, you'll notice the silver plan is the only one that covers chiro. So if that's important to you, you want to steer towards a silver plan. Prescription drugs, all 3 of these plans have kind of a little different way they go about it. On our bronze plan, our generic drugs are $18. There's no limit on that. So if you need a generic drug on this bronze plan, you can get it for $18. On the silver plan, it's $20. And then brand name drugs are $100. And then with our gold plan, there's no deductible and it's just $15 and $40. Now let's go down here to our hospital facility services. This is where it gets a little bit different. You see these percentages, all right? These percentages mean what you would pay after the deductible. So I'll give you an example. So let's say that I'm on this silver plan here and I have a car accident and I go to the hospital for a week and it's $100,000 in bills that I get. I pay 100% of the cost for the first $1,900. After I've paid $1,900, I pay 45% of the cost. KAISER pays 55% of the cost until my deductible plus my 45% equal $8,750. Once I have spent $8,750 on this silver plan in the year, in a calendar year, I pay zero for the rest of the year until through December 31st. All right. So in that $100,000 claim, that accident that I'm getting bills for $100,000, once I pay the deductible plus 45% and I hit $8,750, I pay zero. Kaiser pays 100% of all the costs for the rest of the calendar year. All right, couple things about that. This out-of-pocket maximum, this $8,750, this number includes copays for doctor visits, copays for diagnostic lab and x-ray, copays for generic drugs, $65 copays for urgent care, emergency room visits. Every dollar you spend is going towards your $8,750. Once you hit that maximum $8,750, you pay zero for the rest of the calendar year. Okay? Notice how the gold plan doesn't have these percentages. The gold plan has flat dollar copays after your deductible. First of all, this deductible is only $250, so it's very low. But if I have a hospital stay, let's say I was in the hospital for a week for that car accident. Instead of paying $1,900 and then 45% up to $8,750, I'd pay $250, and then I'd pay $600 a day for my copay. So that's $600 for day 1, 2, 3, 4, 5. After day 5, you no longer pay the copay. Okay. So in that situation, my car accident is 600 times 5, $3,000, plus my $250. So that's $3,250 out of my pocket for that hospital stay. All right. So that's much better than $8,750. Another way to look at this is maybe you're going to have a baby this year. Maybe you have knee surgery or back surgery or something like that coming up. If you have a baby and you're there for 2 days, on the silver plan, you pay 100% up to $1,900. Then you pay 45% until you reach $8,750. If you have a baby on the gold plan, so that baby's going to cost you $6,000, $7,000, $8,000. If you have a baby on the gold plan, you pay $250. And let's say they're for 2 days. 600 times 2 is $1,200. So being in the hospital for 2 days on the gold plan is going to cost you $1,450. That's $250 plus $600 plus $600. That's how I got there. So $1,400 versus $6,000, $7,000, $8,000. So I want you all to be considering what the last 3 years or 4 years of your life have looked like in terms of using your benefits. Have you been to the hospital? Have you had surgeries? Do you go skiing and mountain biking? Do you wind up in the emergency room quite frequently? Now also think about, what can you predict about the next 12 months of your life? Baby, surgery, MRIs, lots of prescription drugs right now. Maybe you need to go to physical therapy a lot. Maybe you have a lot of expenses this year. You should really consider this gold plan. The gold plan will cost you more out of your paycheck, but when you use the plan, your deductible is very low. Your doctor visit copays are lower. X-rays and labs are a copay deductible waive. There's no brand name drug deductible. Everything is cheaper. So while you'll pay more out of your paycheck, when you go to the doctor, you go to the pharmacy, you go to the lab, you go to the hospital, you'll pay a lot less out of your pocket. So keep that in mind. Also important to note, the money that comes out of your paycheck to pay for this, it's called premium. That premium is tax-free dollars. That money is coming out of your paycheck before you pay any taxes on it. So it's important. That's a very important thing to note, because it's a little bit cheaper for you. If you're using pre-tax dollars, that means that you're not paying any taxes on this money that you're spending in premium. Whereas all of these benefits you see here, all these copays, all these doctor visits, all these hospital stays, all these expenses are after-tax dollars. So in order to have, the way taxes, I'm sure you guys are familiar, the way taxes work, in order to have $1,000 to spend on medical claims, you need to make $1,250 in payroll in order to have $1,000 left over. So it's important to note that the use of pre-tax dollars to pay for your premiums every paycheck is a really good deal. If you know that you're going to have expenses, you should be leaning towards this gold plan or at least the silver plan. If you don't think you're going to have much in the way of expenses at all, or you never use your plan, this bronze plan is good for you. Also, the silver is good. So that's kind of a rundown of these plans. Another thing I want to point out is you'll notice that there's individual numbers and family numbers. Okay, for those of you that are enrolling in these plans all by yourself, you don't need to worry about this family number at all. Doesn't mean a thing in the world to you. For those of you that are enrolling with a spouse or with a child or with a spouse and child or children, what you need to know is that you would now be part of a family plan where the deductible is now twice as much and the out-of-pocket maximum is twice as much. However, this term embedded means that no one person in the family is responsible for any more than the individual deductible or the individual maximum. So let's go back to my car accident. I'm enrolled in this silver plan. It's me, my wife, and our 3 children. Okay. I have the claim. I have to meet my deductible of $1,900. Once I've met $1,900, I've met my deductible in full, and then I pay 45% up to $8,750. Once I have spent $8,750, my benefits are covered at 100% for the rest of the year. I don't pay for anything. I don't pay for prescription drugs. I don't pay for doctor visits. I don't pay for surgeries, emergency room, hospital stay, nothing. Okay. My family, my wife and 3 children, the 4 of them would have the other $1,900 deductible combined and the other $8,750 out-of-pocket maximum combined. Okay. So what you're looking at here is no one person has any more than a $1,900 deductible, and no family combined has any more than a $3,800 deductible. Same with maximum out of pockets. No one person in a family pays any more than $8,750, and no family on the aggregate pays any more than $17,500. I want to stop there, and I want to give anybody an opportunity to ask any questions, or if you want me to kind of go over any portion of that again, let me know. It's a lot. I gave you a lot of information there, so I'm going to pause and let me know if anybody's got a question about anything we just discussed. Okay, as we covered at the beginning of the presentation, and as you'll see on the last slide of this presentation, I'm available for questions later on if you've got any. Okay, so if there's anybody that maybe you're embarrassed to ask a question right now, or maybe you can't quite figure out what your question might be, you're welcome to come to me at another time and we can go over it. All right, so we'll keep moving. So those are our 3 plans. Now, here's a couple of slides on some of the added value benefits or some of the other things that you should know about. Number 1, the best thing you can possibly do to improve your experience with KAISER is go onto the website and register your account and download the smartphone app. Okay, once you have this app on your phone, you've always got your ID card. You always can find what your benefits are. You can talk to your doctor through the app. You can set appointments. You can reorder prescription drugs. You can view your claims. You can do a lot of things with that app. The single best thing you can do to improve your experience is make sure you download the smartphone app to your phone. Okay, we all have these phones now that have all kinds of stuff going on. Please take advantage of this technology. I promise you it'll improve your experience. As a KAISER member, you have access to the Calm app. This is something that, as most of you probably know, there's meditation apps, there's mindfulness apps, lowering stress, reducing anxiety, improving sleep quality, lots of really, really, really cool things that are available to you. Again, this is part of what you're paying for. We're all paying so much in these insurance premiums, so I really wanted to kind of give you a heads up on some other things that can improve your life and save you some money. Okay, so you're already paying for this. This is already baked into the premium that you're paying. The Calm app is something that's available to you, And you can find more about that at kp.org/self-care apps. So that's a good option there. Also, speaking of wellness, the Class Pass. So some of you might have heard of Class Pass. This is another thing that's available to you as a member of KAISER. Yoga, cardio, boot camps, all these kind of things. This whole industry took off during COVID. Most of us used to go out running or go to the gym and stuff like that, and then all of a sudden we're all working out in our living room or in our garage. And so these apps have really taken off, and Class Pass is a really, really cool one. So you can get started on that at kp.org/exercise. Again, something that just comes with your membership. So let's talk about our enrollment. So enrolling now is not going to be done on paper. It's going to be done in the enrollment portal that we're setting up. All of you just got this email. If you didn't get this email that you're seeing right here, it just says it's from the ICOHS College Benefits Management System. It says now open employee benefit enrollment portal. And you'll see this message. Again, here's my email address, another opportunity to reach out to me if you should need me. And there's a little green button that says sign up. If you did not get this email, check your junk folder or your spam folder. A lot of times it goes to those folders. If it's not in your inbox or your spam folders, let Jessica know. And Jessica, you let me know. Anybody who didn't get this email, we'll double check the email address and we'll get it back out to you. If we're having problems logging in, no matter what, I've got ways I can set up a username and password for you and get that to you. So this all went out as soon as we hit record on this presentation. These all landed in your inbox. So if you do not see this, if you cannot find this, let Jessica know right away, and we'll make sure that today you can get in. Once you get that link, you're going to be directed towards icohs.ease.com. When you log in for the first time, it's going to give you an opportunity to choose your password. You will accept the terms and conditions. Once you do, you'll hit log in. Once you log in, there'll be kind of an overview where I'm going to embed this video into this portal. You can watch it again if you're having trouble sleeping at night, or you just really love to nerd out on insurance stuff. You can watch it again. Q and Jessica, this will be in the portal for future new hires. They can watch this video and go through this whole training that we just did. You'll enter in your information, your name, your address, your date of birth, your social, all that information. You'll be taken to another page that asks you to enter in your dependents. Even if you're not enrolling in the benefits, even if you're not enrolling your dependents in the benefits, I suggest that you add them to the portal so that you can see what the benefits would cost if you wanted to add your child or add your spouse, and you can just kind of compare to what you currently have. Once you get through adding everybody to that, you're going to be taken to your medical plan options. When you get to this page, this is all going to be gray. It's really easy to skip right past this. That's why I highlight this. This will be the first time all of you have logged into this portal. So you need to hit the check mark here to indicate that you would like to enroll. Or for those of you that wish to decline benefits, no problem at all. You'll hit the X right here. You'll just hit this X. Okay, and I'll turn red. This is a good point for me to tell everybody on this call, no matter whether you want the benefits or not, if you're insured elsewhere or you're not insured elsewhere, your parents' plan, you just don't want insurance, whatever it may be, everybody must log in and make a decision, whether that's enrolling in benefits or declining benefits. We need everybody to log in and do something. So Jessica, I know there's some people that might say, I don't want it, I'm not going to do anything, right? Do I need to do anything? Yes, you need to log in. You need to say no, thank you. We need to help our employer be compliant. Obamacare puts a lot of pressure on your employer to be compliant with the offering of healthcare coverage. And so part of that is a proof of coverage is made. So yes, you must decline. So once you hit the check mark button, you'll continue to scroll down the screen and you'll see the different plans. Of course, we have KAISER, so it's a little different, but you'll see these buttons here. Once you select it, there'll be a big green rectangle that goes around your plan. You'll see your per paycheck cost. This is your number after the company pays their portion on a per paycheck basis. So this is the number exactly to the penny that will be coming out of your paycheck each pay period. You'll have a number of links underneath here where you can open up different documents that can help you understand the benefits better. There's a link to finding a doctor on KAISER's website, so you'll go do that. You'll see your numbers on here on the right on a per paycheck basis. Once you continue through that, you'll go to your summary page. Again, this one, yours is just going to have medical. Once you see what you enrolled in and what the costs are, you'll hit continue right here. Then it just turns into a DocuSign. Many of us are familiar with DocuSign. You'll open up, the next page is going to give you this little bubble that says sign forms. You'll click there. It'll start to generate all the applications. Then you'll see a box to type your signature. You'll type it. Then you'll be able to write your signature. You'll use your mouse to do this, or if you're on a mobile device, you can use your finger right on the screen to do it. It's going to look like you did it with your feet, but don't worry about it. It's still an authorized signature. Once you hit next, it'll take you through every portion of each application, and it'll ask you to enter in. You'll just click, and it'll enter in your signature in the different places that you need to do that. Once that's all done, you'll hit the finish button. You'll get an email that says, congratulations, you've submitted your benefit elections. Once you get that email, you're all done. You can close the whole system and you're done, and we won't bother you anymore, okay? But you gotta finish the signature part. We see a lot of people stop here once they select their plan. Nothing happens if you stop there. You gotta sign everything and hit the submit and finish button. You're looking for that email to the same email address that says you have completed your enrollment. Once that happens, you're all done. So next step, you should all have this email. I saw a couple of people in the chat. There's some people that are still looking for this email. If you cannot find it, let us know. We'll get it to you. We're looking for the deadline for everybody to enroll by Wednesday, February 22nd. If you have any questions, if you need any answers, I will stick around as long as you guys are here. And I'll leave it on this last slide, which is my contact information. And before I open it up to any possible questions, I just want to say thank you for the opportunity and the privilege to be your benefit professional. Health insurance is a big deal, and it's confusing, and it's hard, and it's expensive. So it's an honor to play this role, play this small part in your business and in your life. So thank you for that opportunity, and I will stop talking and answer any questions. If you don't have any questions, you're welcome to, that's where the presentation's all over. So thank you.